Somewhere in the middle of the two extremes lies a world of open discourse. Probing the depths of the in-between, welcome to Gray Matters Radio with your host, Michael Devine.
Yeah. Good evening, everybody. Michael Devine here, Gray Matters Radio. Now, tonight, it's going to be a very special episode. This is one of those episodes of Gray Matters where when I was envisioning what this show was going to be, tonight is literally the embodiment of exactly what I wanted everything to be about this show. Now, this is one of those interesting things. We're getting an election season, and this is where everybody starts talking about all the issues that really matter. And so, unless you've been living underneath a rock, healthcare seems to be kind of a big issue in our elections. And it's always funny when I've had a father, who worked in healthcare my whole life. I'm a clinician, so I've worked on the side of providing healthcare. I've worked for the insurance companies. I have a wife who literally is a healthcare, works as a manager. It's one of those things where you get to see every kind of side, every single angle to healthcare. And so I always kind of find it's hilarious, these debates that we seem to be getting into in this country, where it's about either for Obamacare. And if you're for Obamacare, well, then basically, I guess it means you're basically a communist or something. And then if you don't believe in Obamacare, then then pretty much then you're just heartless, and then we should be, I guess, repeal it and go back to, I don't even really know what we're supposed to go back to, because if you repeal it, that means then that shouldn't there be like a solution that we're supposed to have, and no one actually ever really talks about what other solutions really are. So then it's like, all right, well, what actually is the solution? And then why is it that everyone keeps going back and forth between the government should pay for it and it'll bankrupt the system and provide the worst healthcare known to man, or we go back to a system that we already pretty much think kind of sucks? So what really is the answer kind of then? That's an excellent kind of question. Well, I guess for us to really understand what we do next, don't we actually have to understand what the problem is? I mean, I almost challenge everyone right now listening, go and listen to, I'll go and just try to talk to anybody on your Facebook page and try to see what people are saying about what they think is a problem with healthcare. I guarantee most of them are probably going to think it's really I don't know, maybe it's me, but I personally think most people are going to sit there and think it's the healthcare companies. The HMOs are the evil giants. Now, here's the reality, though. The healthcare companies are kind of messed up. I mean, I'm not going to lie. I've worked for these guys. I know what it's like. But if we're also being kind of honest, the healthcare companies are the only ones really kind of holding the fort back. They kind of keep costs under control. They do kind of keep the providers and the hospitals and kind of in check. But the thing is, that's like saying, if the major problem is the healthcare companies, that's saying like the dam is the problem when there's a flood, or is it we'd look at it's the water coming downstream of everything. And that's really where I kind of think that where we need to really start looking. Anyone who's been in healthcare understands that the problem isn't just the healthcare companies. The problem also isn't the government either. I mean, it'd be great if we could have universal health care, but I think also one of the main issues we look at is it kind of would bankrupt the system. I mean, heck, you can look at like Medicare and Medicaid right now, and they account for a lot of our budget, and a lot of that budget's being eaten up by healthcare costs, especially as we have an aging population. We have like a time bomb of the opiate addiction problem that's just totally annihilating the country. I think They did a study. This is the General Accountability Office. This is like literally our government said from 2014 to present, the opiate epidemic has literally cost our country $500 billion. That is just opiate overdoses, not even any other drug. And they think by 2020, it's going to be over $1 trillion. That's a huge problem. And when we start looking at, that's a huge darn problem. Well, then what else do we need to start kind of looking at? Well, one of the things we need to start looking at, and this is the one thing, and my dad always said, it's funny when they talk about the government, They talk about the healthcare companies, but the one thing that nobody ever talks about is the actual cost of healthcare. Nobody actually talks about, I mean, we hear about the pharmaceutical companies, but we hear about the companies that make the MRIs. Do we hear about the companies that provide all the equipment for all the IVs, dialysis, the hospitals, what the doctors are kind of charging? We don't really hear about that at all, do we? And it's interesting when you have people who work in the healthcare industry that are going 90% of the problem is on the supply side of healthcare, but yet 2% of the discussion is about the supply side. That's letting us know there are some problems here, aren't there? I mean, think about it. Our elected officials don't talk about at all what the main kind of problem is with healthcare. Meanwhile, me, you, Facebook, everybody is arguing about Obamacare, communism, socialism, repealing Obamacare, and still trying to figure out what the hell we're going to repeal it basically for. So the way I look at it, we need to have a frank and honest discussion about it. Now, I could sit there and talk about this for 2 hours. But the thing is, you're not going to believe me. Or maybe if you would believe me, or maybe only a couple people are going to believe me. Well, maybe, just maybe, we need to have other people on this show to actually talk about what is going on in this country with healthcare. The only way we're going to have an honest discussion is to talk to people that are actually doing it. I know it's shocking. If you turn on Fox News, MSNBC, CNN, everybody is always talking. Some pundit that works for some institute I don't even know what the heck it actually even is. And they're sitting there talking about there's some expert, but they're not a doctor. Most of them don't even work for any of the companies. And then the irony is that the people that are actually doing the talking on these shows are lobbyists for the companies. So there's a little bit of a disconnect kind of there with the information that we're forming our entire opinion about this giant healthcare problem. So, you know what we need to do? We need to talk with some folks. Now, here's the interesting thing. So the two people I've lined up for this show, now one of them I'm a little biased on. It's my dad, all right? Now, I know a lot of people are like, oh, Mike, having some trouble finding some guests for your first couple shows. I mean, it's fair. The reality is I wanted my dad on the show. My dad literally, Richard Devine, he has literally worked in a healthcare industry for over 30 some odd years. He's worked as an administrator, as a chief resource officer, vice president of supply chain. Now, I can't say the company that he consulted for because, frankly, he's not allowed to. I mean, think about it. Like, my own dad's coming on the show, and literally the guy cannot say who the company is that he's working for, or actually did work for. The guy's retired. But literally what my dad kind of did, his job was the middleman. He helped negotiate the contract for the hospitals, the device manufacturers, pharmaceuticals, and all that good fun. And so literally, and so think about it, like, already we're setting a stage for, I can't say who I worked for. That's really the problem of what we're talking about here. People that want to come out and talk about it can't even really come on their son's show and really talk about it. Now, not only that, if my dad was not, good enough, and he is good enough, but all right, we got to have somebody else. And then literally my dad said, hey, you're going to do this. We got to have a couple different sides to this. So we're also going to have Brendan I can't even give his last name. I can't tell you where he works, but Brendan, literally, I think he calls himself a cynical libertarian, if that tells us really anything about him. He had to go and get permission from his employer to come on, and he can't say companies that they've worked with, can't say who he works for. So this one's going to be kind of really interesting, but once again, I'm setting the stage for these guys are talking about what is really wrong with the healthcare industry right now. And every one of their employers or former employers are saying you can't say anything. So this is going to be interesting. So I hope I don't get anyone fired. So with that amazing intro, I would like to bring in Brandon, the cynical libertarian, and Richard Devine. Gentlemen, are you there?
Yeah,
we are.
Hey, Mike.
Hey, guys.
Mike, how you doing?
Doing good. Thank you so much for being on the show, guys. I mean, I know I wrote it on my blog that, some of these guys, on a condition of anonymity, these guys literally can't say too much. And I'm like, I was not joking. I spoke with these guys for, a couple hours even before the show. And we can talk about a lot, but it was so crazy to me that we had to protect so much about what you guys are about to talk to us about. But I want you guys to kind of describe, who you guys are. And of course, I don't want to get anyone in trouble. So we'll start with Dad, Richard. If you can tell the audience a little bit about how you came into working in healthcare. What your general roles were in the healthcare industry, and also even make a good little case for why you have such a unique perspective on this healthcare debate in the country.
Oh, wow, you got about 3 hours.
But, I mean, this is a podcast, so I really we can kind of do what the fuck we want. I mean,
into healthcare as a second career, Mike, as you know, I was in heavy manufacturing, in the automotive industry and, in the Ohio area. And when I was approached by a CEO of a local hospital system that was probably a medium-sized hospital system who had, because at my last position, I was in strategic planning, cost control, new car development. And he had gotten my name from several people who said, he wanted to, and this was around about 1987, 88, in which managed healthcare was just coming into Ohio, and a lot of the places had started to see the destruction that managed care was doing, especially out there in California and Texas. So, long story short is this. We met, we spoke, we talked a little bit about what my current employer there was doing, what I was doing, and what, cost controls, standard costing systems, really, how did manufacturing identify costs? And I think that's going to be some of the areas that I know Brendan and myself will look at, is the transparency of cost. And before I knew it, I did an assessment there, and the next thing you know, I'm working for that hospital. I resigned my position and moved over to healthcare, and I was there with about 10 years with that system, and then just moved on to several others. Another system in which I was there for almost 11 years, in which I was the senior. I moved up in the supply chain up through as the senior procurement resource officer, and was also in the operations, the non-clinical operations of healthcare, and a very large healthcare provider. And then essentially for about the last 10 years, I've been doing consulting.
So basically, long story short, you know exactly what you're talking about. When it comes down to what things cost and, getting the best deals for pretty much like the hospitals, you know exactly what you're talking about. Where pretty much all the bodies are kind of buried for the most part with what hospitals are charging and, what they're buying it for, basically.
Mm-hmm.
Now, Brennan, so now that's Richard's kind of side. Now, Brennan, bring in your kind of side of how you got yourself into healthcare and what your kind of role is in this whole little, racket, whatever we want to call it.
Well, I've been fortunate enough to basically run the gamut, not only doing medical device sales. I was part of the GPO side of things, group purchasing organization side of things. And I was also on the provider side, heading up a supply chain department for a hospital system on the East Coast. So I got a lot of exposure to the ins and outs of, pricing and contract negotiations. And I got into this industry because of the volatility in finance where I started my career. So it was just by chance that I got into this. And the positions that I've had were just basically built on relationships that I was able to cultivate. And part of the reason that I'm trying to keep this anonymity, but it's going to be kind of hard, especially with the cynical libertarian. I appreciate that.
Is that going to be the dead giveaway? Or like, going to be like a lot of people
probably.
going, oh, I knew who that was.
Oh, yeah, absolutely. But, I think that, getting into this industry just happened, by mere chance. And I got in through the sales route and then made some connections, suggestions from other people, take this route, go this way, go that way, and getting that exposure to all sides of the table from a negotiation standpoint, from pricing transparency standpoint. So there's a lot I've been able to do in a relatively short amount of time. And, like to Richard's point, we've seen a lot, and we've had to endure a lot. So, and there's a lot of things that people are not talking about. So hopefully we can shed some light on that.
Well, how frustrating is it? Because I know me, I'm an angry person, as my wife, as my dad, I'm a passionate guy, maybe not angry. And I know, just knowing what I know about a lot of things, I get so frustrated when I hear, especially politicians, go up there, start talking about things, and as blatantly, obviously, they have absolutely no idea what it is that they're talking about, whatever talking points that were given to them. And it's especially for something that's so important like healthcare. I think for me, why I'm so profoundly passionate about this topic is that more on the mental health side, it is brutal when there are so many people out there that cannot afford care, whether it be on the mental health side, substance abuse treatment or mental health treatment, how much money people are making, whether it be out of network or even what the insurance kind of covers, is just, or it's medications that they can't cover, or a medication where, the insurance company will say, well, we'll approve this one, we're not going to approve this one. And people literally having no options, and then hearing our elected officials throw out solutions or ideas or fixes for this problem, and it has nothing to do with what's actually going to fix it. And it almost makes you real cynical and frustrated and almost hopeless that they're not going to fix this. And how it's almost sociopathic. It's how I don't understand how they can keep making this decision. And that's where I was like, you know what? If people knew what the truth was, they knew how the system actually worked, they would know, regardless if you're right, left, libertarian, purple, red, blue, whatever it is, they're going to know they are full of shit, and they're going to demand them to tell the truth. Or they're going to look for people and electing people that are actually going to address the real issue. So if you guys, what was like the first moment, and Richard, we can start with you. What was the first moment in your healthcare career where you kind of realized, wow, that was really messed up?
Well, that's a good question, but I would have to say right from the very beginning when I went and did an assessment at as I mentioned, how the CEO came to me, and I went in there and did a week audit. I lived in that hospital, interviewed people, went through their supply chain from ordering, requisitioning, to how products are identified, bill of materials, and essentially, how do you want to put it, is nobody really knew anything. They really didn't have a handle on costs. Basically nobody really could tell you the cost. The other part that was really very obvious is when you come from a manufacturing background, is the selection of products, the building of the bill of materials. The costing negotiations are basically all very much centralized within the contracting and the supply chain and the research and development people. When you go into healthcare, and Brenda can tell us on this one, is that you have every Tom, Dick, and Harry that is able to specify and demand, this is the product that we're going to use, and that this is the only product we'll use. And then those relationships, then those vendors with those products are really no longer looking at the hospital as the customer, but they're looking at the person who is wanting to use those products.
Now, why is that? Why was that shift important?
Pardon?
Why was that shift important when it went from, hey, what was good for the hospital, but more toward, hey, what is the provider kind of one? Why is that such a big thing for people to understand?
Well, I think, when we talk about that, what's good for the hospital, what's good for the patient, it's not necessarily always what's at the forefront of the physician's mind. To Rich's point, they build relationships with vendors, and whether they're given money to give speeches or teach a course on whatever, they usually get what they want, especially if they're bringing in the number of procedures that they are. If they're a high mover, they basically can call the shots, even though a CFO or a CEO or board of directors says no, we're not going to go down this route. They're going to say, you know what? If I'm not going to be able to have this product, I'm going to take my business elsewhere, and the hospital is going to take a hit. So the hospital then is saying to themselves, all right, our hands are tied. We have to go this route. But they don't take into account the contracts that are in place, the relationships with the group purchasing organizations, basically saying, you know what, you're with us. You have to use this organization or that organization. The organization you want to go with is not even on contract, so you're going to be paying list price. And that's a lot of times where the increase in overall cost for a procedure goes into play. You just have a lot of moving pieces and a lot of opinions that go into this. And, to your point, every Tom, Dick, and Harry has an opinion on something. There isn't just one way of doing this. And you try to standardize, you try to get the best price for the best value. And it should be focusing on patient outcomes. But at the end of the day, it's really what, Dr. So-and-so wants or what, he really needs. So there's a lot of moving parts and a lot of different levels that come into play when a decision is made to go with a certain vendor for a certain product or even a service. And you don't have that level of authority to say, doctor, either you're with us or you're against us. Take your business elsewhere, because, at the end of the day, if that procedure is not going to be done at one hospital, they're going to go down the street to their competitor and they're going to get that business. So there's a lot of moving parts that people don't really realize or take into account at the end of the day.
Now, does that explain why one hospital can be charging one amount for a procedure, a device, whatever it might be, and then down the road, they could be paying something completely kind of different? Is that exactly kind of what started happening?
Well, yeah, I think it goes even further than that. And I'll give you a personal example. A number of years ago, I had an abscess underneath one of my teeth, and my girlfriend took me to the emergency room. And all they did was basically have me sit there, wait about a half hour to be seen. And I got a pretty high threshold for pain. All of a sudden, I'm blacking out because of the pain. They lanced the abscess. They gave me a Percocet, and they sent me on my way. And then I got a bill for almost $10,000. And I'm saying to myself, I could have drank a bottle of scotch and lanced that myself. Why didn't I do that? And you think about it, it was literally a scalpel, a Percocet, and 20 minutes of a resident's time, and I was charged almost $10,000.
Wow.
So you think about stuff like that, and you say, where does a hospital get off charging something like that? And it's not the insurance company, it's not the manufacturer of a certain product, because at the end of the day, it was a scalpel and a Percocet. A lot of the problem too lies with the hospital systems. I mean, a lot of times they can charge whatever they want. People question it, but to your point, who's driving the cost of these procedures? A lot of times, the cost of a product or a service depends on the size of the institution or who they're affiliated with or associated with. So to my point before.
Is there a formula that goes into what they charge? I mean, when you guys have asked them, I mean, you guys work with the hospitals. I mean,
that's the key that I was saying on the transparency of costs.
Right.
Is when they go and they start building the costs for DRG groups or how they come about room rates. There's basically, if you want to look at it very simple, high level, is essentially the financial people are going to build what is called the usual and customary rate, which is, without getting into real detail, it's a rate that's inflated very high to assure what they're going to get levels, in some cases on levels of reimbursement from Medicare.
So what drives it? I mean, do they have I know most businesses, and Dad, this, you worked in manufacturing. I mean, most businesses have, we want to keep this margin. there's a margin if it was a restaurant industry, a margin for retail. I mean, is there like a guy? I mean, is there a guy that sits in a room going, well, these are the margins? I mean, who?
Well, what they'll do, I guess you could say it almost something similar to that, but the key that's going to come out is this: when they build up their rates, and the hospital systems, operate in really two different economic spheres of influence. One is when they go to the marketplace to buy labor, and all the factors of production in economic terms, they're dealing with a capitalistic market area where it's market dynamics. So they're going to be hit with supply and demand. So basically, they really don't have too much control on what they're going to pay. They're basically going to have to pay what the markets, i.e., nursing shortages, physicians, whatever. But when they go into revenue, they're going to operate in a couple. So they're going to operate in one where there's the one payer could be a private payer. And a private payer is a person who really is uninsured and he has no commercial or he's not on Medicare. Okay, then you're going to have your commercial, which is going to then is the act of negotiation with your managed care contracts with those insurance dealers, in which they're going to negotiate rates for the for the patients that they're going to cover. And then you have the regulated or the government controlled, which is your Medicare, Medicaid rate.
So basically there's like 37 rates to really.
That's what I'm trying to tell you. So what they do is they start out with what they would consider called gross revenue. So every time you go into an ER, like with when Brendan went to the ER, they just take all that and it's called the gross. So then you get an explanation of benefits. So depending on who you are and who your insurance carrier is, then that gross rate is going to get hit with a contractual, which means in some cases they could lose 40 cents to 50 cents on the dollar. Okay, so then they come back to where now that's their net revenue, and this is their margin from that procedure. Now, Medicare is already, they can't negotiate that. That's already negotiated by the government, and they could charge $100,000, and they're only going to get $1,000.
So now here's a million-dollar question.
I had an MR done, and I got the bill, and it was something like around $5,000 or $6,000. I don't know what it was. And when I got my Medicare explanation, it was something like around about $900 is what they paid. Now, the problem, you get in there is they're saying, okay, well, now we got a revenue problem. It depends on your payer mixes. So they start now adjusting what's your payer mix.
So if they're not making enough money in one area, they will adjust the rate to somebody else.
Yep.
I mean,
exactly.
How is that allowed?
I sat in a meeting once, and I was sitting there, and I basically threw my pen down because I was trying to put my costs and all that together. And I said, well, how are you getting to all of these costs? And they said, well, how much is 1 + 1? And I said, well, I guess 2. And he goes, no, whatever number I want it to be.
Oh my God. I mean, I gotta wrap my head around this for a second. So I look at like in retail, like think about like bait and switch. If you say it's one price, but then they come in and then you change the price or you kind of switch it with another product, that's illegal. As a clinician, if I were to charge one client this amount and then without like a sliding scale or anything, charge them a different amount, I can get in some serious trouble. So how is it they're able to do this? I mean, it seems really messed up.
It's negotiated. So
that is it just with the companies?
Contracts to what that MR could be $10,000, $900 to Medicare, but it may be $1,500. So it's all done by a contractual, and that's where you get into payer mixes.
Well, this is where I'm really curious. Then is that when you look at the money, okay? Because I know there's kind of like 3 layers to this. You have the hospitals, you have the providers, and you have the supply side, right? are the hospitals really are the hospitals really the ones making money, or is it more on the providers that are really making the money hand over fist? Because the way you describe it, it almost seems like a lot of hospitals really aren't making that kind of money, but then it seems like the doctors are the ones that, well, they just get paid for the procedures. They don't have all the overhead. I mean, am I right there? Or am I wrong?
Hey, Brendan, do you want to answer that?
Yeah, I mean, you're right. I mean, a lot of the doctors are not getting paid for each of these procedures. They're not bringing in the, call it the buku dollars. Yes, they are making a sizable salary, especially if they are employees of the hospital. But, you know, the hospitals themselves are making money. Don't kid yourselves. But at the same time, you know, really it's the device companies and even some of the other organizations that go into these contract negotiations that are making money off of this stuff.
So yeah, speak to that part, because I think then it's like, and once again, like it's about painting this picture. So it's like, okay, right. So now we see on one hand, okay, the hospitals, they pretty much can willy-nilly decide what they're going to charge. There's no rules, there's no ratios. It's whatever we want it to be. And I think that, as you said, what's 1 + 1? Whatever it is that we want it to be. They can rob Peter to pay Paul. We don't like what we're getting here. We'll raise the rates here. We have the doctors who have really been empowered by the device manufacturers going, well, we want your product, and they get differing prices basically depending on how many procedures they do. And I think that's probably why then you see a lot of doctors going off and starting their own surgery and outpatient centers, so they can just be on both ends of it. So then now we start kind of going a little further upstream, and it's like, well, okay, yeah, they're all making money, you know, I mean, not, but as you said, not buku bucks. And then, so now we got the device manufacturers, we got the pharmaceutical companies, we have the pretty much, so how does that then work? Because if the hospitals are kind of trying to somewhat justify, $5,000 per MRI, well, what is it that these companies then are charging, and then how do they set their rates then?
It's based on volume.
Yeah.
Primarily, I mean, the long and short of it is it's based on volume. If you have a small institution that's not doing a lot of procedures, you're going to have a manufacturer or a supplier say, you know what, we're going to charge you X amount of dollars, but you go to a big teaching facility or you go to a multi-facility hospital system, they're going to be paying less because they're doing a lot more. These device companies see where the benefit is, where they can make their money, even if they're charging less, because they see a lot more going through those systems as opposed to, you know, the smaller community hospitals. And we talk about affordable healthcare. You know, I brought this up to you, Michael, yesterday when we were talking. Is it truly affordable healthcare when you have a community hospital in the middle of nowhere trying to service its, you know, clientele, its patients, the citizens of that area, but they can't actually do it, or they try to do it and they try to negotiate contracts with some of these large vendors, and the large vendors are coming back and saying, you guys are doing 1-2 procedures a year. We're going to charge you this price. There's going to be no contract. This is what it's going to be. And they have to do it, or they're going to lose that business to someone else. And these patients are going to be forced to drive a couple 100 miles and, you know, spend a lot of time and energy and money getting to a different hospital, seeing a different doctor, seeing a whole host of other clinicians. And, you know, that's where it becomes convoluted and complex, because, you know, we talk about everyone having this healthcare at our fingertips, but is it truly, you know, affecting everyone in a positive light? And part of me, you know, being the cynic, is going to say no, because you're still going to have those organizations out there charging whatever they want, or they're going to, you know, work with the GPOs and set certain standards or set different tiers to their contract levels and set the pricing. So there's very little negotiation at that point. So it's basically being set by the manufacturers or suppliers.
Yeah, and adding into that too, again, as I mentioned before, the first observation I ever had moving from, you know, like from an automotive manufacturing, which is a very controlled environment for vendors, is all of a sudden you're seeing vendors you're seeing vendors all over the place, uncontrolled. I mean, a lot of the systems are getting it under control. now, but you can't control what goes on outside the hospitals. But a lot of the specification for the products are being done by the actual subcontractors, which could be your physicians. And the next thing you know is that the pricing becomes artificial, and it tempts because of the fact that that physician is only going to use that product. So now you're getting into where your attempts to try to negotiate or try to convince to make a change to a vendor who has presented maybe the opportunities, if we could consolidate or move market share, that there could be some significant savings.
Like, I just went online and looked up Siemens Medical, because I know they make a lot of MRIs and CT scans, right? Mm-hmm. So I went and looked at, so they're a European company, and I went and looked at their revenue. And what would you guys think their 2017 revenue was? You had a guess.
I used to know all that.
Billions.
Yeah. Because it crosses so many, they have so many divisions.
Think about 13.7 billion euros.
Mm-hmm.
And so here's what I'm trying to understand. So now I get the idea of buying in bulk, right? You buy more of something, you get a discount, right? But when we start talking about, we're not talking about a car that everyone needs, right? We're not talking about, we're not talking about some kind of textile or some type of clothing. We're talking about something that's going to save somebody's lives. When you have a company making $13 billion for them to basically, strong arm a regional hospital, going, well, you're only doing one or two, so we're not going to give you a price break. I mean, where do they get off? I mean, have you guys ever had any conversations with executives or people within companies like this? I know you can't say who, but have you ever just been like, how much is enough? Why is it you guys have to charge so much when you're making billions? You can't use the whole adage of, well, a lot of money goes into R&D, because if you use their logic, they should be making maybe hundreds of millions of dollars after, wages and taxes and whatever else. But we're talking billions. What is their justification? I mean, has anyone ever given you a straight up? All right, now, can you guys help me understand? Was there ever a conversation any of you have ever had with an executive where they literally said, hey, Loki, this is kind of why we're charging what it is that we are? I mean, is there anything? I mean, has anyone ever really been honest with you as to why they do what it is that they do?
No.
No. I don't think they're ever going to tell you why, and that's just the nature of business. The only key that you got to, if you have the ability, and again, there's a lot of very, very good organizations, going on out there where they're controlling the specifications. So they're working with the user groups and keeping the vendors in the back seat, not letting the vendors be in the driver's seat. And what they're doing is, and it's very effective, is they're basically saying, what are your clinical needs? What do you need out of the equipment? What is it you're going to do? The procedures you're going to do, and then you do your RFIs and all that, and get all the equipment. And the next thing you know, you've got a pretty generic spec. Once that happens, and then you go to all the vendors, and they know there's competition, then you'll start seeing a different price level. Okay, so if you can instill competition, then you'll start seeing pricing move.
Well, it seems like I know one thing. I had a client of mine who was an executive with a pharmaceutical company, and I can't say which one, obviously, but one of the questions I asked him was, "Listen, like, I mean, I'm like, honestly, between me, you, and the wall, is there wiggle room in these pricing, and why is it that they charge what it is that they charge?" And he goes, the whole thing about, oh, well, we Americans, we end up paying for a lot of the innovation. He's like, dude, that's BS, because the top 20 pharmaceutical companies, maybe one of them is American, right? And he goes, he goes, there's a ton of pharmaceutical companies that you never even hear about, because, when they're making medications, it costs a ton to do R&D. And many of them, because they're not making any money, they're only clinical trials, they are heavily reliant on private investors. Even if they go private or even they go public, now you have a board of directors and you have the shareholders that you have to basically be, responsible to. And he goes, a lot of them do go out of business. A lot of these drugs do not make it, past clinical trials. And so when you have a company whose main job is literally just to be there to make money, you have people that are investing in these companies. I mean, maybe some of them have a, personal history with, it could be cancer treatment, it could be stem cells. But people are investing in these companies because they realize I can make a lot of money doing this. I have an opportunity to really make a killing. And so that's what they care about. And he goes, honestly, if I were to go to the board one day and go, hey, listen, I think we're being maybe a little bit too greedy on this one. And maybe we have a duty to this humanity to maybe make this affordable. He goes, I'm going to lose my job. Not only am I going to lose my job, I might get sued. I'm never going to work in a publicly traded company ever again, because instead of doing what is best for the company and the shareholders, I'm doing what I think is best for humanity. And a lot of times they're mutually exclusive. And so basically what I'm being forced to do is make a decision that I think is best for humanity, and do what's right and fair, and then basically ruin my life. And someone else is just going to come in and do it. Or I go along with the board wants. I do what's best for the company because technically speaking, that's what you're supposed to do. And he goes, that's the main issue that you're dealing with any major kind of company. And he goes, what do you do with that? Especially when you have people like we saw it with Martin Shkreli. We saw it with, what's her name? The Theanos girl. The one. Theanos. Yeah.
She made billions. Yeah.
Yeah. I mean, we have people coming in that are really pushing the envelope. And the messed up thing with Martin Shkreli, his investors actually made money. That was his defense in his trial. How did I defraud investors when I made them money?
Right.
And it seems like that's kind of what we're dealing with, pure, true and through greed. And I think you guys have seen it firsthand. You guys have seen it. I mean, like you guys know what it's like to negotiate with these guys. I mean, is there any give, or are they playing you hardball? Like, no, we're gonna make the most amount of money that we can.
It depends. If you're talking about, the industry leaders, the big boys, there's very little wiggle room. If you're talking about the up and comers, yeah, you have a little bit of wiggle room. But at the same time, you got to think, if I'm challenging something or someone because I think it's my moral obligation or it's the ethical thing to do, and someone doesn't like that decision, because this industry, for as big as people think it is, it's very small. You're going to get blacklisted, and you're going to have a black mark next to your name for the rest of your career or whatever's remaining of it. So you almost have to sit back and bite your lip, and then you question your own self and say, am I going to bed with a clear conscience? And, a lot of times you feel like you're not, and that's what keeps people like me up. I know it keeps Rich up late at night. You try to do the right thing. But at the end of the day, I mean, really what talks? It's money. And, Rich, go ahead.
Oh, no. Go ahead.
That's a great, I think Brandon, that's a great point. It's like, what is that like for you guys? I mean, to see what it's like on the inside, and then really not being able to do anything about it. You still got a family. You still got to, you still got to take care of yourself. You have your company. I mean, what really is that like, knowing what you guys know, seeing the effect that it's having on people, and then really feeling you can't do anything about it?
Well, I think at our levels, when it comes to sometimes the drugs and other areas, in some of these situations, especially with first generation drugs, is the U.S. has permitted them to really be monopolies. There really isn't a competition for that drug. So they're using the patent, whatever. And then, so basically the companies are looking at it and saying, hey, look, I only have I think it's 20 years or 10 years, depending on what the patents manufacturer can start producing it, which now means technically that's the way in which the drug goes down. But in the first phase, they're going to extract all they can, and you can yell, scream, and holler, but it isn't going to do you any good at that point, because what is it to the physicians or whatever if they need that drug to treat their patients? And people, I mean, and not to be doing there, but the drug company, they do, every vendor that is out there, from medical devices to drugs, no matter what, they have very good marketing that go, and they convince people that this is the ultimate in patient care. Mm-hmm. And then you have the point where the patient has the right to demand that you not use a generic drug, that I have to have the name brand drug. I mean, it's a very, very complex variables that go into all the pricing and how much volume is going to go, where the discounts are going to be. I know it sounds high level, but yeah.
But the thing is, I mean, that's the problem. This is such a complicated issue, and the way our politicians and media people make it sound like, oh, it's so damn simple, and it really isn't simple in any way, shape, or form. It is such a convoluted issue. Now, here's the $1 million question, because the whole idea of the show is, okay, we can take like a rough understanding of a problem, and then it's about going, okay, well, what is it that we can do about it? And if I'm hearing what you guys are kind of throwing out there, it's kind of like the Wild West. They are getting away with something because it's legal. I'm a huge racing fan, and in racing, it's not cheating if it's not part of the rules. And if anything, if you don't push the envelope, it's almost kind of like egregious that you don't push that envelope and try to get and squeeze whatever horsepower you can out, or whatever performance kind of area. And so if these guys are able to get away with it, of course they're going to get it. So then now that begs the $1 million question. Is that technically something that, should there be rules? Is there any, I'm cynical myself and realize that we can't get anyone to agree and vote on anything pretty much. So anything big, sure as heck ain't going to pass, right? But if we're really looking at what is realistic, what is something that is literally, because what I'm hearing is, if we bring down cost on the supply side, if we control, basically stop this whole wild game of, we're going to raise our prices here because we can charge whatever it is that we can. We have no cost controls on any of our margins. We can literally make $1 billion on anything, and we can get away with it, and we have the right to, because those are the rules. So basically, are you guys both saying that unless the rules change, the costs are still going to keep going up? They will still keep raising their prices. The hospitals will raise their prices in tune. The doctors will raise their prices. They'll keep doing the procedures, which will make everyone else more money. Costs go up, and then meanwhile, everybody else pays a crap ton kind of more. I know it's overly simplistic way of looking at it, but is that a good general sense, right?
Well, I think, to that point, you're talking about the wild, wild west, and yes, it's still out of control. Yes, there's a lot going on, but if you go back 20 years, you go back even longer to the 80s, early 90s, mid 90s, even the late 90s, a lot of these device companies and pharmaceutical companies were whining and dining a lot of these doctors, and they were getting them on board to basically use their product because they were getting wined and dined, or they were getting some sort of kickback. But now you have the Sunshine Act, where you have to report anything. Basically, if you receive a lunch, you have to report that, from an anti-kickback standpoint. So you talk about regulations and some oversight, there are some, but it's just scratching the surface. It's not the wild, wild west, but it's pretty damn close still. But at the end of the day, who's to say the government or any of these legislators are going to come in and make the right decision. I mean, they're probably even more ignorant on this stuff than the common folks. For them to come in and say, you know what, we're going to do X, Y, and Z because this is how we think it should be done, you're going to get a lot of pushback from physicians, from hospitals, and really from the entire healthcare industry, and say, who are you to tell us what to do? You don't know the first thing about what we're doing. And I'll be the first one to claim ignorance. I don't know a lot of procedures. I really don't know the ins and outs of every medical device out there. So I'm not going to claim I'm an expert, but you really want to upset a doctor or upset a hospital administration. You get some of these folks, saying, well, this needs to be regulated and that needs to be regulated. Then you push someone's back up against the wall, then they're really going to get upset. And that's, I think, even more of a divide. So you got to tread carefully because of these multi-layers of not only the physicians, the hospitals, the vendors, the GPOs, and everyone in between. There are just so many layers and so many levels to everything that goes into this stuff that people don't even think about, to your point earlier, Michael. And until that happens, until that realization, that aha moment happens, there's really not going to be any change. And there might be some cost control going into it. There might be some pushback, and the monopolies, whether it's from a robotic standpoint, with more organizations having a robotic device in there, they're going away. But there's always going to be some evolution, and that's one of the biggest things with healthcare. It's an evolving industry. It's an industry that is trying to be on the cutting edge to make sure it's helping people, it's save people's lives, or at least that's what it's supposed to do in theory. So,
and I think the key of it is you just can't concentrate on supply chain.
Right.
That expense is just one. I mean, you have to go in through the revenue part. Where are they getting the revenue? What are the payer mixes? What are they negotiating? What are with them to identify their costs? One of the things that out there working in the consulting and things like that is that you see a lot of tests. I mean, because of the issue of the ability that you can go to court and sue or whatever, is there's tests that are run, and on those tests, how many of those tests are actually reimbursed? That the hospital, the attending physicians have ordered 7 panels of a blood, okay, and only 2 of those panels are going to be reimbursed. But the hospital has to eat, the other high cost, because the vendor, as I was trying to say before, if a vendor bills you for $1, you have to pay the $1. The hospital has to pay the $1. If a hospital bills a patient $1, he runs the risk he's only going to make 40. He could lose 40 cents, 35 to 40 cents on every $1. Okay, so when you're looking at supply, it in the healthcare cost, it goes entirely around. It's a never running perpetual machine that you're trying to fix on one end, then you get hit on the other end. And when you're buying equipment, okay, it's you could buy we'll just say you could buy a 16 slice CT, or you could buy a 64 or 128 slice CT, but the tests that you're going to run on it, they aren't reimbursed. So what is the most practical pieces of equipment? And again, those are some decisions that have to be made, not by any of us. Those are coming down to where the groupings, the specification groups and everybody else are making those hard decisions.
Now, here's a $1 million question, though, because here's what's interesting. And Brandon, I'm really interested to get your thought on this one, being our cynical libertarian, right? So to me, there's a perfect storm going on. A lot of my conservative friends, one of the big things they always talk about is, universal health care and why it just never works. It's going to bankrupt the system. And I think given what the costs are, it's not really outside the realm of possibility. I think you look at a lot of the European models, and they're always kind of on that border, right? But when we hear a lot about balancing the budget, we talk about let's cut Medicare, let's cut Medicaid, Social Security, let's really kind of get in there and cut entitlements, right? Because we need to do that to balance the budget. But here's what's mind-numbing to me is that, and so if none of these politicians, and I don't buy the whole thing of, well, we just don't get it. They have entire think tanks and policy people that tell them what the hell is going on, right? And so we know that they know what the score is. And this is both sides of the aisle, Democrats and Republicans, right? No one's talking about this. But I'm really curious on that libertarian, Republican, conservative side. They want to talk about saving all this money. But the thing is then they're allowing all these – they basically are allowing – the pharmaceutical companies, the device manufacturers, the hospital, the doctors, to completely rape the system and make money hand over fist. The lobbyists are going there and obviously allowing all this to happen. They're not talking about it. But it's kind of hypocritical, it almost seems like, to where if you guys would actually hold these people accountable, we wouldn't have our systems being raped for mad profits. And we'd actually be able to bring the cost down of Medicare, Medicaid, Social Security. We have an aging population. We have this drug abuse problem where literally, and I said the number earlier, it's going to be over $1 trillion. So we have all these poor people that are usually on Medicaid or unsubsidized care, utilizing all this care for the substance abuse issue. We have all these people that are using their insurance to go to the substance abuse treatment centers, are charging $45,000 a month for care that maybe has a 10% chance of actually working. Is it hypocritical that they're not the ones sitting there going, well, if we want to balance the budget, yeah, we can cut granny off at the knees, we can cut we can cut welfare, we can cut all that, or we can just keep our boys in check instead of making $18 billion, maybe only make $5 billion. They're still all rich, they still get their Ferraris, and we're not mortgaging our future. We're not paying out all this money, and then we're actually able to balance our budget. And even more crazy, if we bring our costs under control, maybe we actually could have universal health care and start focusing on preventative health care, which would then actually lower costs even more because people are actually going to the doctor instead of, hey, I'm going to drink some Jack Daniels and lance this myself. I mean, Michael, maybe I'm wrong, but
no, you are spot on. You actually took the words right out of my mouth.
Yeah.
I was going to say point blank that we are such a reactive society right now, whereas I think a lot of the other, whether it's the European nations or some of these other, call them universally healthcare driven societies, are more preventative. We're reactive, and if we were able to get to that preventative level, going down the route of doing testing, genetic testing, to find out if I have a family history of breast cancer or colon cancer or some other disease, then we might be able to get things in check. But it's until we get to that level of being proactive and taking that preventative approach, we're going to continue to be reactive. We're going to still see a lot of issues. Like, one issue that no one's really talking about is diabetes. Yeah. I mean, diabetes is so prevalent and it's affecting so many people, and the cost of it is just astronomical. But if you take a look at, pre-diabetes, or, take a look at preventative care, or educate people on what they should and shouldn't be eating, then yeah, it falls on the laps of the people at large. And being proactive is really where we're going to get the biggest bang for our buck. No pun intended.
Oh, yeah. Literally, I just looked this up. According to the CDC, $117 billion is the annual cost of preventable medical problems.
Mm-hmm.
Think about that.
Yeah.
Preventable.
Yeah, well, and the more you deny people access or cut their benefit to there, okay, now they won't hit those ERs.
That's right.
Until they're in massive comorbidities.
And Dad, you told me that when we started talking about Obamacare, was that the biggest fear that the hospitals had was that you had people that had been out of the system for so damn long, and the cost for them to enter the system after they had all these problems, it was astronomical. And it's, and this is where it's mind numbing to me that I'm not an expert on this. I'm an expert on the mental health side. But this seems so much like common sense when you hear, I mean, literally, have you ever heard a single politician mention anything that even tackles what we are talking about tonight?
Not to this level.
Yeah.
Not even close. But, the thing that I will ask is, if we go down that universal healthcare route, who's going to pay for it all?
Yep.
Are the hospitals going to pay for it, or are the taxpayers going to be forced to pay for it, which is going to increase taxes tenfold? And will people be willing to do that? I mean, yeah, I believe that everyone has a civic duty to help those in need, and everyone has that responsibility to lend a helping hand whenever possible, and help those who want to be helped. But it's really going to fall on the shoulders of the people at large to say, hey, you know what? I need help. I want to be proactive about this, rather than just throw their feet up, and whether it's drink a bottle of Jack or sit around and gorge on a lot of junk food. We're not going to be able to sustain that. I mean, people are not going to say, you know what, raise my taxes 10, 15, 20, 25% so I can pay for someone else's healthcare. And what is that going to do to healthcare at large? Are we going to get the same level of healthcare?
I think even less
we're going down that route.
Well, I think even think about. I mean, really, it's one way of looking at it is, yeah, I'm raising taxes so I pay for someone else's healthcare. But then where I also kind of look at it is, so we could technically have universal healthcare. So instead of it being about, I'm going to be paying someone else's healthcare, if we don't do anything about the system the way that it is, we're going to be, everyone gets universal healthcare. So doctors, pharmaceutical companies, and all of them can make even more money. They can make billions while we bankrupt ourselves. And that's really, and I think really what we're laying out there is that before we can even have a discussion about universal healthcare, we have to have a discussion about, we have to bring the cost down. And the way the system is right now, there's no chance in hell of that happening. We have to have an honest discussion in this country of what type of country do we want to be. I love capitalism. Capitalism is what has allowed our country to have the innovations that it had. But the same breath, though, it's like in football. If you have no referees out there, everyone's going to get killed, right? But then we also see, like this season especially, when there's over-refereeing. And really what our democracy, what our capitalist democracy is really about, it is about freedom. But in the same breath, well, we have laws, we have rules, because people are going to be greedy. And we have rules in place. People are going to do things they shouldn't. We have laws in place. And so is it necessarily a bad thing to have a discussion about, well, maybe there should be some policing, realistic policing, instead of it being one group trying to screw the other out, or vice versa? Well, how about we all sit down at the table and start coming up with realistic regulations to where you can make money, you can have the innovations that you want, so you're bringing in all those investors, but at the same time, though, not at the expense of healthcare, not the expense of people deciding what healthcare they get. It's messed up in this country, and I do feel like there needs to be safety nets. But then there's something wrong when, like my wife, when we were down in Texas, there'd be literally, we had doctors, we had a Medicaid doctor at her hospital that literally wouldn't marry his girlfriend because he wouldn't marry her until he delivered her baby so he can make money on the delivery. When we had people coming in having 3, 4, 5 kids, all kids that have been taken away, kids that are being born because there's no prenatal care, there's a lot of times drug abuse. All these kids are in the NICU, they're being handed up, and then they're scot-free. They're coming in with iPhones and purse, like Louis Vuitton purses, and then don't have to pay anything. But then my wife and I have a daughter who had a very minimal NICU visit. Literally the most minimal NICU stay that anyone could possibly had. And we had a $15,000 bill out of pocket. Why is it that you have 2 hardworking people, one that works in a hospital, me, a clinician whose job is to help people, and yet I have to take it on the chin? That's what's unfair. We want to talk about Obamacare.
Well, that's my point.
Yeah,
that was my point in bringing all that up. How is that fair for a hardworking individual to be charged umpteen amount of dollars for 2-3 days stay in the NICU, and someone else who is going out and abusing drugs, abusing the system, and walking around with designer stuff. I don't understand how that's plausible or that's even fair to those individuals who are going out, earning an honest day's pay. Yes, they're paying for part of their health care, but their companies are also paying the other part. But they're still getting a bill for an exorbitant amount of money, where other folks who are not employed, they're not contributing to society, and they're walking around with designer stuff, and they don't have a bill to pay when they're in the ER or the NICU constantly. That's where I question the whole thing.
And that's the thing, and nobody is talking about that. And nobody's sitting there going, well, hey, we have a big swath of the population that's really getting screwed over. It's like me being self-employed. Everyone's talking about tax break for this, tax break for that. Well, where's a tax break for the self-employed? A lot of people don't realize, hey, I got to pay an extra 14 point whatever percent in taxes.
That's right.
It's basically it's like an effective tax rate of like 40%.
Right.
No one's talking about us. Hey, self-employed are the backbone of the country, but yet you don't have one person going, hey, maybe we should lower the taxes on the self-employed. Instead, you got to hire an accountant that can get creative with the pass-through entities with the new tax laws. But then whatever money I'm paying this expensive accountant to save me my money, I'm going to spend more money on that. There's this inherent disconnect of there are no good solutions right now in this country. And that's the problem with the debate in this country. You say one thing, you're a communist. You say this, you're heartless. The very nature of our political discord with the media and social media is that you even so much if you even say something that's compromising, it's a bad word.
Right.
Nothing ever kind of gets done. And if no one can talk to each other and have a real conversation, no one gets down to the bottom of what's causing all the problems.
Michael, it's like that. It's like the old adage. I know that I was brought up this way. You were brought up this way, and I know Rich was. It's not what you say; it's what you do. But now it seems to be it's what you say and not what you do that gets you by. And everyone's just saying, "Oh, well, you know what? I understand that Senator so and so said this, or Congress person said this or that," but they don't act on it. You won't see them do anything or follow through on anything. They're just going to pander. Actions speak louder than words to a lot of folks, especially like the baby boomers, folks our age. But no one's willing to take that accountability. And I guess my question to the whole policing and regulating of all this is, who's going to do it? Mm-hmm. Who's going to step forward and do this? Can we rely on the government to do it? Are they truly experts in this? Can we rely on, medical device organizations or pharmaceutical companies or anyone in manufacturing to come forward and say, you know what, we had a banner year last year. We're going to, kick things back a notch. You don't know. And because we are a capitalistic society, corporations are there to make money, but they're also there to produce products that, one, want to be purchased, and two, are going to benefit people. But are they really going to say, you know what, we're going to do the right thing? And a lot of these organizations in their mission statement say we're going to do the right thing. We're going to be trustworthy. We're going to be transparent. And I think what we're talking about right now, and I brought all that up to get to that word transparent, is there is such a lack of transparency across this industry that you really don't know where to begin or who to, one, trust, or who to rely on to get things done, or can we actually get things moving to where costs are reduced? So go ahead, Rich.
Oh no, I think, and what you're talking about, and you and I had these conversations a couple times. I think out there looming is the healthcare could come through as a major not an evolution, but a revolution, in which Amazons. Your Amazons are going to come into the fold, the Walmarts of the world. I mean, you hear it all the time. Amazon's interested in healthcare, but also CVS merged, with that. That could begin to break the monopoly to where healthcare becomes, it's the same thing as making a car and buying a car.
What's the power of the people?
That drives where it's no longer going to be in a controlled environment. It's going to be controlled by people who know how to make the systems work.
Well, if you think about it, I mean, change has happened so radically fast in this country. I mean, Dad, think about growing up from like the 50s, 60s, 70s, 80s, 90s and how slow change was. But all of a sudden with social media, oh, wow. I mean, change happens at an exponential rate. And I think that's where we look at going, what is it going to take to change? And I think we all get into that, well, it's going to take forever. And it's like, well, just like social media has radically changed the country, and I think maybe a little bit of a negative way with all the rhetoric we've seen. And, whether you want to argue, it's a different episode for a different day about how much rhetoric is affecting some of these, like the bombings and everything. But we can turn it on them. We can unite people faster than anything that's ever been united before. If everyone in one big loud voice going, no, we're not going to take that anymore. We know what the score is. We're not going to be allowed to be used anymore. You're not serving us. For far too long, our government officials have basically felt like, well, because all the employers in this country employ everyone, and if you don't do this, the whole system comes to a crash, that we have to pander to them. And the reality is, you know what? You have to balance it out. But it's been way too far in their direction. Now, we don't want a pendulum swing in the other and stifle things and lose jobs. But you know what? The time has come for us to sit there and go, okay, how many Ferraris do you need? How many houses do you need? When you have billionaires having dick measuring contests with yachts, okay, you don't need, no human being needs that much. You're making way too much. You can have your one yacht, have a badass Ferrari, have a great house somewhere. You don't need three of them. And think about, for that one house that extra house you bought, hey, you could have saved people money. You could have paid your employees more money. I mean, it's crazy. But the time has come, I think people are waking up. I think, Dad, you said it best. Companies are now getting wise where, hey, we're going to have buying power now. Just like doctors started using their clout to go, hey, we have the numbers. We're just going to take it elsewhere. We're going to go do our own thing. Well, it's a simple formula. Maybe we all need to start doing it ourselves.
Usually when you go in and you see a hospital where doctors invested, okay, they're for profits, most of them. Mm-hmm. And they really turn a profit. They do a very good job of policing compared to the regular. That's what I'm saying. This whole thing is so many variables involved in where there are some operating models, is just which one. But I really do think it's going to get commercialized, healthcare. And it's going to come into telemedicines where you're going to access, with the use of the technology is going to be there. You're going to get other companies that are going to come into this, and that's where I think the revolution is going to happen and the solutions are going to come. Whether or not it's going to be good care, I don't know, but I think the more I look at it a little bit, just listen to what they're doing, that could be the approach to preventive medicine. And then the hospitals are going to become the area in which they don't need these gigantic big behemoths to let them say how beautiful I am, where they're carrying all this overhead. It's just strictly they're going to be handling those cases, in which the preventive medicine has just gone over to where now it's going to remedial medicine. I mean, I had brain surgery, about 3-4 years ago, and I was on, for 7 hours, and I was out the next day. That's where it's going to hit. And I think the only way it's going to happen is when you get other new forces into this market that is also going to provide.
And that's where and I think where we almost need to carry this conversation, because it's all fine and dandy where it's all three of us having this cool conversation with each other and our listeners, right? This is where I think we need some congressmen on this show and kind of going, all right, help me understand. Okay, you're saying this, but this is what the score is. Help me understand, like the whole Columbo thing. Help me understand how what you're saying is fixing this, because I would be remiss to figure out if any congressman or senator would be able to say anything that anyone has suggested is fixing what you guys are kind of talking about. And it's not going to be an easy fix. Today is just a start. Today is just about educating people, letting people understand that, hey, listen, there's a lot of power in going, think for yourselves. Here's one bit of information. You don't have to take everything that any of us have said for 100% fact. But hey, listen, this is information. Challenge your elected officials. Email them, write them, call them, and go, listen, help me understand, because this is my understanding of this healthcare system. Help me understand how that's going to fix based upon this. No more of these gotcha things of, you took money from this person. We could do that. The only thing that's going to do is then it's going to be like this lobbing back and forth, like gang warfare on each side. It's like, all right, that ain't going to work. Challenge them. And when they don't answer the question, challenge them again. And when they're not going to, challenge them again. And if they're not going to give you the right answer, they're not going to serve you. That's where you get people together. I think we're waiting for our politicians to make the change. And they ain't going to make that change. So it's on to us. They're giving and serving up what they can get away with. And for far too long, we have all this information at our fingertips. We're only looking at one thing that validates whatever it is that we are thinking. So we have all this information. We have all this power. We have all this voice. We have all this ability to start really saying in a very loud voice going, no, we're done. We're not going to do this charade anymore. And we're demanding change. We're demanding that you serve us. And if you don't, we'll get people together that are going to serve us, people that aren't going to kowtail to this. And so I think where we need to continue this conversation, we need to get a lobbyist in here. We need to get a congressman, even a former congressman. And I think that's the next conversation all of us need to have. And, and I think that is where then we can start really maybe getting some real legitimate legislation. So, and wrapping things up, any last words for both of you? You guys have been awesome. I appreciate you guys putting your jobs, livelihoods, reputations on the line by coming on. But hey, listen, this is stuff that people really needed to know. Is there any last bits of wisdom, word for any of our listeners to hear, call to action, anything that you feel as though that is going to help with this situation, or just one last main point that you think is going to help out?
Just because I would say, because this is such a convoluted industry, having that visibility and transparency to information is really going to get this thing kickstarted. And, without that, we're probably going to continue going in circles. So until we have that transparency, I don't think anything's really going to take off. So that's what I will leave you with today.
Yeah. Dad?
I think the biggest thing too is also the consumer has to be a little bit more, have to delve into, there's a lot of sites that compare costs, for procedures and become more. Now, the problem that's going to be with that is the fact if they have a commercial insurance, does the hospital that has the lowest costs or whatever, do they have a contract with that commercial payer? Which means if they do, they can access it. If they don't, then they're forced to go to the hospitals in which there's contracts. But I do think that the more the consumer's putting the pressure on, is that then that's going to start changing.
The power of the people. And there's a lot to that. There definitely is a lot to that. I always look at, we used to be, a country that, we put men on the moon. We had a challenge going, hey, we're going to put men on the moon. We're going to return them. Yeah, there are some conspiracy theorists out there who think we never did. But I think we actually did. All right. Once again, another conversation, another day. Although we did talk about that on Saturday, conspiracies. But we used to be able to accomplish so much, man. Our political system's always been a little bit screwed up in some way, shape, or form. But we used to be able to accomplish so much. And I'm raising a daughter. I got a 4-year-old. And I want to be able to tell her going, listen, this is a country that is we have the ability to accomplish so much and do so much. And I feel like I can't tell her that right now. And I know it can be, which is why I'm doing what I'm doing. It'd be easy just for me to kind of cruise back, be in private practice, and not do anything. But I can't do it anymore. This country can be so much greater than what it is right now. And we're so taught that we're so against each other and so divided. We're really not. You take away the anger, the vitriol, all the bullshit, we actually can talk. We can actually have good conversations and accomplish things again. And that's all it takes. And that's what this is about. That's what the conversation is about. So take what you're hearing. Once again, call to action. Do something. Ask your congressman about this. Ask your doctor about it. If you have a neighbor talk to people. Ask. Get information. That's what my dad always taught me. Dad, what do you think about this? Go and read it. Learn about it. Ask questions. Get it from different sources. And let's take that and come up with a solution. Go on, you can catch us on, graymattersradio.org. You can find a lot of our old episodes. You can go on our Facebook where I'm always posting articles, and I want people to get involved in discussions, talk with each other, even if you disagree, challenge people. If there's somebody who is on your Facebook list that feels strongly one way or the other, share our show with them. Have them listen to it and go, hey, based upon what you heard, does that change your thoughts at all? Does it change your opinion at all? Let's have a discussion about it. Democrats, Republicans, Libertarians, whatever other name people are coming up with for whatever, ridiculous parties that we kind of have, It's not too late, guys. This country can solve this. I know we can. I see change in my office every single day. I see changes in organizations every single day. We just got to talk. We have to solve this. We have to. It's imperative. We can't sit there and argue anymore. Can't point the fingers anymore. I know we're all angry. We're all pissed off. But we can solve this. We don't have a choice. So on that note, thank you for my guest, Brendan, the cynical libertarian. Richard,
you,
Dad, you guys are awesome. Thank you so much for coming on the show. Thanks for all the listeners. And I will for surely have you guys back. We're going to get some congressmen in here. We are going to get some folks in here. And if anything, Brendan, I got to get you back on. I got to hear more about the cynical libertarianism. Because I'm kind of curious about it. So we're going to find a way to get you back on here. But thank you so much. And on that note, I will catch everybody the next time on The Gray. Thank you so much and have a good evening.
Thank you for listening to this episode of Gray Matters Radio with Michael Devine. For more episodes and information, visit us online at graymattersradio.com. Join the conversation by following Gray Matters Radio on Facebook and Twitter. Gray Matters Radio is a proud member of the HC Universal Network family of podcasts. For more live episodes of this and other great shows, download the free HC Universal Network app at hcuniversalnetwork.com. Thanks for tuning in, and until next time, remember, think about the gray.